Hi guys, and welcome to the first episode of Medical Lingo. Okay, but first, before we dive right in, fun fact: did you know that the first open heart surgery was carried out by Dr. Louis Gibbon in 1939? Medical lingo is just me translating words that we use in our day-to-day lives, probably, but in medical terms. And the first word that we have on our list is deglutition. Deglutition meaning, did I just say sleepiness? Meaning swallowing. The act deglutition means swallowing. The next word that we have is emesis. Emesis means vomiting. The next word that we have is somnolence. Somnolence means sleepiness. And the next word that we have is insomnia, which is an what they call it antonym, for somnolence, which means inability to sleep, lack of sleep and all of that, struggling with sleep. Then the next word that we have is halitosis. This one is my personal favorite. Halitosis meaning bad breath. The next word that we have is nocturia. Nocturia meaning waking up in the middle of the night or waking up to go and urinate. But before we continue, another fun fact. Did you know that the first heart transplant using an animal's heart was carried out by Dr. James Hardy on January 24th in 1964? The recipient was a 68-year-old man called Boyd Rush, who received the heart of a chimpanzee, but sadly, he died 1 hour after the surgery. Regardless of the unfortunate incident, this experiment was a huge step towards xenotransplantation. Xenotransplantation is the transfer of tissues or organs from one species to another species. The next word on our list is bulborhythmia, which means a rumbling stomach. The next word is flatulence, which means passing out gas. The next word is astenopia, which means straining of your eyes. The next word is bruxism, which means teeth grinding. When you grind your teeth together, that's what it's called. The next word is perspiration, which means sweating. And the next word is crepitation, which means joints cracking. That's how you crack your joints. Let's have another fun fact, but it's going to be calculated. Now, there's something that we call stroke volume. The stroke volume is the amount of blood that is pumped out with each beat, that is pumped out of the heart with each beat. And the average volume for this is 72 milliliters. And now, the amount of times the heart beats per minute is the average amount is 70 times per minute. Now, if we multiply that 70 times 72, we're going to have approximately 5 liters of blood are pumped out from the heart within each minute, per minute. That's what we call our minute volume. Now, let's do some calculation. In a day, we have 24 hours, right? And how do we get the amount of minutes in a day? We multiply 24 times 60, and that gives us 1,440 minutes in a day. Now, multiplying 1,440 by 5 liters, we are going to get 7,200 liters. So that just tells us that in a day, the heart pumps out 7,200 liters of blood. Isn't that amazing? Okay, the next word that we have is odinophagia, which means painful swallowing. The next word that we have is cephalgia, which means headache. Last fun fact for today is that the largest heart ever recorded weighed 1.5 kg, and this was seen in a patient with hypertrophic cardiomyopathy. And that's being compared to the normal size or normal weight of a normal heart, which is 280 grams to 340 grams. Thanks for watching. Please like, share, and hit the subscribe button, and watch out for part 2 of Medical Lingo.